You're double cleansing, you're using the right actives, you've even ditched dairy, but those blackheads still there. Why? Hi, I'm Dr. Mamina Turegano, a triple board certified dermatologist, and today we are diving into the real reasons your blackheads keep coming back, even when you're doing everything right. This video isn't just about surface level fixes. Yes, we will go into all the skincare you should be using, but we're also going to dive deep into misunderstood skin types, to comedogenic ingredients, and what's even happening in your gut that could be leading to blackheads. So let's get into it. Part one, what blackheads really are. What most people call blackheads are, well, the formal term are open comedones. And these are clogged pores filled with sebum, dead skin, and bacteria. The contents, specifically the sebum, oxidize at the surface because it's exposed, and that turns black, hence the name blackheads. But, and this is a big but, many of you are actually dealing with something called sebaceous filaments, which actually aren't blackheads at all. So, quick fact, according to a 2013 review in Dermatology Research and Practice, sebaceous filaments are normal, having pores are normal, okay? It's the black dots that we want to address. Part two, why blackheads keep coming back. So let's talk about the hidden reasons your skin might be getting oilier and what to do about each one of those reasons. So first, cleansing mistakes. Washing too often with harsh cleansers can potentially damage your skin barrier, which can actually trigger more oil production. So annoying. But on the flip side, not cleansing enough lets sweat, pollution, product buildup, all of these things could lead to more oiliness and more clogged pores. So what's the happy solution? I do recommend cleansing twice a day with a gentle pH balance formula. I'm also a big fan of the double cleansing method at nighttime, where you're using an oil-based cleanser to bind to the oil that's in your pores and also to the makeup and the grime and the buildup from the day, getting that all out and then following that with a gentle cleanser. Okay, second, the wrong actives. So too much salicylic acid or retinol or tretinoin can irritate your skin and trigger rebound oil production. So what's the solution? And when I say cycle, that means not use it every other day. Maybe alternate between your exfoliant and your retinoid and have an off day. And of course, I'm going to talk about my favorite actives and how to incorporate them into your regimen. Third, comedogenic ingredients and heavy occlusives. So even natural products can be pore clogging. Think coconut oil or lanolin, and very heavy moisturizers or ointments like petrolatum or thick butters can actually trap heat, sebum, all that content into your skin. And then that can potentially lead to clogged pores and blackheads. So what's the solution? I think it's important to read ingredient lists, and I know it's tough, but there are ingredient checkers out there online. I know Personal Day makes a great one. I was an advisor for that ingredient checker list, and basically you can Google your product online, copy the ingredients, and you can paste it in the ingredient checker to see if there are any that are even remotely potentially concerning to be comedogenic. And remember, you can't always trust what's on the label on the front of the bottle. And if you are prone to oiliness, it's still important to moisturize. I would just recommend looking for something that's more lightweight, like a gel or a lotion. Okay, so fourth is fungal acne or malassezia. This can look a lot like stubborn blackheads, but it does need different care. So what's your solution? I would look for ingredients like sulfur or ketoconazole or zinc. They can help somewhat with blackheads, the sulfur and the zinc can. Fifth, hormones and stress. So hormonal changes, especially during puberty, can increase your androgens, which ramp up oil production and can clog pores. Stress can have a similar effect. It can spike cortisol, indirectly affecting your oil production. In fact, cortisol can actually make your oil sticky or more inflammatory, and that is prone to more clogging of the pores. So what's the solution? You want to manage stress with lifestyle strategies. Easier said than done. My biggest advice when it comes to stress is to just switch your perspective. Sit back and be like, how big of a deal is this really? So it's really putting things into perspective and looking at the things in your life that you have that you take for granted for, and realizing that overall things are going okay. But in terms of just like quick things to help manage stress, I do think that learning how to say no to things is helpful. I think that just stopping and taking 3 slow breaths can just shift things immediately with whatever you're dealing with right then and there. I think that practicing gratitude is huge. I'm not gonna go into all the stress management tips. That's a whole nother video, but simple things. And the whole point of this is to just be aware of the stress that's in your life, because stress is inflammatory, stress affects your oil, and we can't have it affecting our skin, okay? Of course, it's gonna have other health issues too, but we're thinking about our skin, right? Skin's so important. JK, obviously our health is the most important thing. 6, poor ventilation and pollution. So tiny particles, and we're talking about like size PM 2.5, if they settle on your skin, they can clog your pores and oxidize oil. So what's the solution? Antioxidants can definitely help combat some of the stress from the pollution, but you also wanna make sure that you're cleansing thoroughly at night to really get rid of all the buildup that you're exposed to from the day. So seventh is sun damage. Chronic UV exposure can weaken the collagen and lead to a type of blackhead formation that we see often in older adults. This is called Favre-Roch-Boucher syndrome. But even in younger people, if your collagen is weak, you're prone to having more expanded pores, hence getting filled up more easily and becoming more prominent. So what's your solution? Obviously, daily sunscreen to prevent further sun damage. We're going to talk about retinoids and other products that can help build your collagen. And then you may also want to consider in-office treatments to really manage the texture and the comedones. Eighth, your diet. So high glycemic foods, so high sugar foods, and dairy can both spike insulin and increase sebum production. What is the solution for that? So obviously minimizing sugar, minimizing dairy. I'm a big fan of the Mediterranean diet where it's full of fiber, full of fruits and vegetables, and minimizing some of the processed oils too. Basically, you want a well-balanced diet without a whole bunch of sugar and dairy. And then ninth, medications. So there's certain drugs like anabolic steroids, testosterone therapy, or birth control pills. These can all affect oil production. Testosterone can definitely increase oil production. And even steroid medicine can affect the oil production in your skin. And there's a bunch of others. There's other medicines in the psychiatric world that can affect oil production. So if you're noticing more oil production and you were started on a new med, I would definitely talk to your doctor about it. Obviously, your dermatologist should know as well if it could be involved with your oil production or your increased development of pores or acne. 10th, climate and humidity. So we know that hot, humid environments can naturally increase sweat and oil output. What's the solution? You gotta remember to cleanse, okay? If you're super sweaty, it's important, after activity outside, if you're playing sports, if you can wash your face pretty immediately after that, that will make a big difference, especially if it's super humid outside. And then also just remember to wear lightweight moisturizers. I like gels, lightweight lotions for people with oily prone skin. And finally, genetics. So some people are just simply born with more active sebaceous or oil glands. What's the solution? Honestly, you can't change your genes, of course, but you can manage the triggers that we talked about to keep your oil production under control. So what's the bottom line? Oily skin isn't just about one thing. When you identify the root cause, you can choose the right fix and get your skin back in balance. Part 3, your gut could be the missing piece. So emerging research shows that your gut microbiome could be directly impacting your oils production and inflammation levels. In a 2016 Journal of Investigative Dermatology, great journal, changes in gut bacteria were linked to more severe acne symptoms, particularly on the nose and chin where blackheads love to live. A balanced gut can help regulate insulin, reduce inflammation, and support healthier skin turnover. So what can you try? Well, consider incorporating more fermented foods into your diet. These can enhance or increase the diversity of your gut microbiome. These include things like kimchi, sauerkraut, kefir. You also want to increase fiber in your diet from things like veggies, seeds, lentils, beans, things like that. And then of course, avoid high sugar spikes and processed snacks as much as possible. If you can avoid antibiotics, if that's even possible, that's helpful too. Part 4, solutions that actually work. So let's reset your blackhead strategy. First, gentle exfoliation. I love beta hydroxy acids, specifically 2% salicylic acid, because it's oil soluble and can get deep into the pore to dissolve the mix of sebum and dead skin cells that cause the blackheads. So use about 2 to 3 nights per week, not every day, so that you don't strip your skin barrier. I'm also a fan of glycolic acid. This is an alpha hydroxy acid. Not only will it help clear out the keratin on the surface or within your pores, but it could also stimulate the collagen surrounding your pore to keep that pore structure strong and to prevent it from expanding and making the blackheads bigger. If you can find a product that combines both BHAs and AHAs, you can get double the benefits in one step. And then for sensitive skin types, I would consider looking at enzyme exfoliants like papain or bromelain. These are great alternatives. They can gently break down the keratin plugs and pores without the sting of the acids. Another exfoliating ingredient that I think is nice for people with sensitive or dry skin are PHAs, polyhydroxy acids. These are more hydrating as well. In terms of alpha hydroxy acids, you may also want to consider lactic acid. This one is not as harsh as glycolic acid and has some hydrating properties as well, but it can, you still have to be careful. And it also depends on the percentages of all these products too. So pay attention to that. Next category of ingredients that's super important are retinoids. So these work at the source by normalizing cell turnover. They're preventing the sticky buildup of skin cells that clog the pores over time. Adapalene 0.1%, which you can get over the counter, is one of my go-tos as a very accessible retinoid over the counter. It's effective, accessible, less irritating than potentially other retinoids that are prescriptions like tretinoin. Now, if you want to go stronger, talk to your dermatologist about prescription retinoids like tretinoin, tazarotene, or Tazorac. These can be game changers for really stubborn blackheads, but remember, they're potent. Really, any retinoid, you want to start slow and you want to moisturize well. Of course, you want to protect your skin barrier. Another ingredient that I love for kind of sebum regulation is niacinamide. It's not a pore unclogger, but like I said, it can help regulate sebum production, it can calm inflammation, and of course it can support the skin barrier, which makes it harder for blackheads to form in the first place. If you have good, healthy skin, blackheads are less likely to form. I'm also a fan of clay masks, especially those with kaolin or bentonite clay. They can help draw out excess oil from the surface and keep your pores looking cleaner between your exfoliation days. I would say to use them like once or twice a week. And I would just focus on like your blackhead prone areas, like in the T-zone area. And then please, just one quick note, at least in the beginning, I would not recommend mixing your exfoliating acids like your salicylic acid or your glycolic acid with retinoids on the same night. Maybe eventually you'll be able to combine them, but in the beginning, please do not do that. That combo can sometimes be too harsh for some people and may backfire by causing more irritation, skin barrier compromise, and more breakouts. And of course, moisturize. Yes, even if you have oily skin, skipping moisturizer can actually make oiliness worse. So when your skin feels dehydrated, it can respond by producing even more sebum to compensate. The key is really to choose the right formula. You obviously want to do non-comedogenic and look for a lightweight gel cream, lightweight lotion, something that can hydrate without feeling too heavy. I'm talking about so many different ingredients. I'm going to mention all my favorite products in the description box below, so keep a lookout for those links. And the other thing with moisturizers, I also recommend making sure to look for niacinamide as an ingredient in your moisturizer because, like I said earlier, it can help regulate sebum production and also further strengthen your skin barrier. And another thing, as a reminder, is to double cleanse at night. If you wear SPF, makeup, or live in a polluted environment, one cleanse often isn't enough actually to really fully remove all the buildup makeup sunscreen from the day. Like I said, you want to start with an oil-based cleanser or balm to dissolve the makeup or sunscreen. You can use micellar water too, and then follow that with a gentle pH balanced water-based cleanser. And then this can help ensure that your pores stay as clear as possible without stripping your skin barrier. Obviously, barrier repair is key. A compromised barrier means more inflammation and overactive oil glands trying to protect your skin. So use ceramide-rich moisturizers to replenish what's lost and avoid products with high amounts of drying alcohols that can leave your skin tight and reactive. I mentioned clay masks earlier, but overdoing them can dehydrate the surface of the skin and trigger more sebum production. So like I said, just keep those to once or twice a week and just focus on your like oily, more congested areas. And like I said, there's a lot of different things that I recommended. So check out the specific products that contain these ingredients in the description box below. Part 5, a note on pore strips, tools, and squeezing. So let's talk about the quick fixes everyone's tempted to try. Are pore strips, extractor tools, or even just squeezing your pores satisfying? Absolutely. But are they long-term solutions? Not really. When you squeeze or force out a blackhead, you risk pushing debris deeper into the pore, causing inflammation, broken capillaries, and potentially even scarring. Metal extractors and vacuum devices can also cause trauma to the skin and tend to give temporary results, and the pores can just refill back up in days. Now, when it comes to nose strips, if you want that instantly cleaner look over the nose, there's a safer route. So my go-to is to Personal Day's unplug blackhead melting nose strips. Instead of ripping the blackheads out, this strip uses a gentle formula to soften and dissolve the contents of the pores so that removal is much less harsh on your skin barrier. It's a much kinder option than the traditional pore strips that yank at your skin. I'm such a huge fan of this. Bottom line, your best results come from consistency. Please keep up with your exfoliation, your retinoids, cleansing, and barrier repair. Pair that with the occasional safe pore softening, pore strip treatments, or clay masks, and you'll notice a real difference without damaging your skin. Oh, and of course, don't forget your sunscreen. Blackheads are frustrating, I know, but they're also complex. Like I said, there's so many different factors in our lives that could be contributing to blackheads, and sometimes it's impossible to address them all, or any. Even with the best skincare products, your internal health, your hormones, your environment, these can all play a role. You don't need to strip your skin to make progress, okay? You just need the right strategy for your unique skin biology. If you found this video helpful, please let me know in the comments and share your biggest blackhead struggle or solution. And if you're curious about the connection between gut health and aging skin, check out my video right here. Thank you so much for watching, and I will see you next time.